Your doctor has recommended a shoulder arthroplasty, also known as shoulder replacement surgery. The shoulder joint is a ball and socket joint. This procedure is used to relieve the pain and loss of joint mobility associated with arthritis. These conditions involve loss of joint cartilage and wearing of the bone, causing restricted mobility and pain. The procedure involves an incision which is usually at the front of the shoulder. The damaged or arthritic parts of the ball and socket bones are removed. A channel is created in the arm bone to hold the new ball part of the joint. The socket is resurfaced with a special toughened medical plastic. This is impacted into the bone to secure it. A metal head is attached to the stem. Contact of this special medical metal with the bone forms a strong direct bone implant interface without the need for cement. To finish, the incision is closed with sutures or skin staples. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.